a very experienced diabetologist. His name is Dr. K.B.
Okay.
Joshi.
Yes.
So Joshi ji, please give us a little introduction about yourself so we know who we are hearing from.
I am a practicing diabetologist in Parle East, Mumbai. I have a private clinic as well as I work for a charitable hospital, namely Babasaheb Gawade Charitable Hospital in Parle East, Mumbai. I have a experience in this field of more than 40 years and I am associated with a teaching activities also.
Where do you do the teaching?
Yes, I have been teaching in where our association and our colleagues and my students and interns.
Very nice. So he is also teaching and he is also giving advice on how to prevent diabetes and
Yes,
also if someone already has it, how to treat it.
treating.
Um, please tell us what you think are the main causes for people to get this condition.
It is the excess of calorie in our diet and poor exercise, poor consumption of that calorie which we have already consumed. Now, if I consume a calorie, it is my duty to, if I have eaten sufficiently in form of calorie, I have to utilize that calorie. If my calories which are more than my utilization, naturally I am going to put on weight. So I have to restrict my weight. I can restrict my weight by adequate diet and adequate exercise to cover up my calorie consumption. I should have adequate carbohydrate, judicious quantity of protein and fat with natural and soluble and insoluble dietary fiber. I should have adequate quantity of fruits, vegetables, which will provide me with both dietary fiber as well as it will take care of my gut microbiota as well as it will help me cleaning my bowel regularly. I should have adequate sleep also.
That's wonderful. So, what we are hearing from Dr. Joshi is good diet, good exercise, and good rest. Three things are very important to avoid getting sick with diabetes, right?
Because diabetes and insulin resistance is a source of most of the lifestyle related disorders.
Lifestyle related disorders. That's a very nice point Dr. Joshi has made. So, we will ask him a little bit more about this. But before that, I remember you were saying about diet, like calorie intake. So, from your experience, what kind of foods are people eating these days that increase this calorie intake? And what kind of foods that people are taking that make this sickness come to them? And how they should change to, when you say eat properly, tell us a little bit more like what kind of foods they should eat so they don't get this sickness.
The refined carbohydrates which we are eating in form of polished rice, foods which contain predominantly maida and
Maida is white flour.
white flour, yes,
Mhm.
and sugar.
But so many like baking companies, they mostly use white flour, like bread, cakes, you know, cupcakes, so many things,
But
cookies.
then wheat bread is also available.
Yes, but generally they use white flour.
Yes, but then wheat,
So
yes,
one has to see that you are using the whole meal grains, right?
yes.
Okay. Now many people, they are becoming like they are developing gluten allergies. So how they can
They
work
can
with it?
eat a diet which is predominantly rich in natural dietary fiber as well as we can use millets that will prevent them from gluten
And allergy.
enteropathy.
Um, what kind of age group have you noticed they are getting more sick with diabetes?
Diabetes has started increasing with a reduced age. younger and younger people, they become diabetic, and surprisingly, even the teens are becoming type 2 diabetics.
So what's the difference between type 2 and
Type 1 diabetes is that your body is not producing insulin at all. Type 2 diabetes is your body is producing insulin, but your consumption of calorie is too much, which your body insulin can handle it.
so it's diabetes affects production of insulin in the body.
It's a excess of consumption of calorie.
For those who don't know much about insulin, can you say like what insulin does in our body?
Insulin helps in utilizing our carbohydrates and assimilation of that calorie into carbohydrate, protein, and storage of fat.
So insulin helps break down the food pretty much.
Yes.
It helps digest the food.
Utilization and storage.
So I hope you are getting some idea how eating properly can help us prevent from diabetes, right? And then you also mentioned about having a healthy exercise routine.
Yes, because we should maintain a sufficient muscle mass also, because it is the muscle mass which will help in utilizing these calories which we have eaten. So we should not see that we lose our muscle mass. So adequate exercise, muscle building exercise is very much essential.
What would you say for people who are already like very thin? They don't have much muscle on their body. You know how in Ayurveda
yes.
there are different body types.
Yes.
There is Vata, there is Pitta, there is Kapha. So from what I am aware, people who are more Vata type, their body generally they cannot gain much weight due to the constitution. So
Whether you are well built in muscle or not, it is not a very significant. Whatever you consume has to go to your muscle. Your muscle should be trained muscle. A trained muscle utilizes calorie more than an untrained muscle. So we have to utilize all those muscles, those who are underutilized or unutilized, like exercise related to abdominal wall. Generally, abdominal wall muscles are flabby muscles. They don't consume the calorie. So when you train your muscle in such a way that they are also built up, they will also start consuming your calorie. So regular exercise, muscle building exercise and resistance exercise is very, very, very essential to prevent diabetes.
So many people they go work out in the gyms. They
Yes,
do,
that is
they
very
do,
good.
They
That
do
is
lot
very
of,
good. Yes,
lot
that
of
is very good.
weightlifting.
That is very good. That is very essential. That is very essential.
Would you say that is better, or like are there some other types of exercises you
Yes,
would
you can
recommend?
have all indoor exercise, you can have all outdoor exercise, even walking for 45 minutes to 1 hour.
Every day?
Brisk walking, yes, daily. Yes.
Brisk walking.
Brisk walking, yes.
How does that help?
Because it utilizes our muscle. It improves our muscle power.
Are there other some sports or some
Yes,
exercises you would
any
recommend?
sports, any outdoor sports and indoor gymnastic exercise
I see.
will help you in building your muscle. Simple resistance exercise.
But
I say
some people, let's say some people, they don't have any inspiration to do exercise or sports because maybe they are not happy with their body. Maybe they are too big or too small or whatever reason they have. So what would be your advice to them?
once they start doing it, their body will come in
Good
shape.
shape. Good shape. That's a very nice advice. Another point you mentioned is about getting proper sleep, proper rest. I'm sure you know, living in Mumbai, you meet people who tell you how busy their life is, how hectic their life is. So in this kind of society, in this kind of situation, what do you suggest to your clients, how they can find a healthy balance where they can have a good diet, good exercise routine, and get proper sleep?
We should restrict fat also to a rational extent. fat is essential for body, but then it should be a judicious. It should be combined with natural dietary fiber diet so that the fat absorption is reduced in the diet. So diet has to be very judicious. You should give enough rest to your body so that your body can assimilate that protein which you have eaten into a muscle mass. So a holistic approach to diet, exercise, and vitamins, and adequate sleep, adequate exercise is a must.
Have you met clients who have sleep disorders, difficulty getting sleep?
Yes, one of the very important thing I will like to bring it to your notice is snoring.
Mm-hmm.
You must try to rule out if you are snoring.
Mm-hmm.
You should find out whether you are going in for some sort of sleep apnea or not, because that is one of
What's the word you said?
sleep apnea.
Sleep apnea.
Yes.
Tell us a little bit more.
Sleep apnea is a time when you start snoring. You wash out carbon dioxide and your respiration gets suppressed for few moments. During this time, lot of inflammatory markers are secreted and lot of cardiac arrhythmias are set in. So this is the time which is very risky, where you can develop stroke and heart related issues.
Wow, that's scary. So,
So good quality of sleep is very essential.
So snoring seems like a very common also. Many
Yes,
people
many
snore.
people they sleep, but they snore, which is a poor quality of sleep.
What causes snoring to happen?
One of the cause is obesity.
Okay. But I think even people who are not obese, they
They
also
also
snore.
snore.
So what
They
are
also-
other causes of snoring to occur?
Well, to
Is
my
it
mind,
like is it also like how people sleep, like what position you are sleeping in, or
well,
what,
if you sleep in a flat position,
like on your back?
yes,
Mm-hmm.
snoring reduces.
Okay.
Yes.
But do you know some other causes that make snoring to happen even with people who are not obese?
Well, I don't have much idea.
I see. Well, thank you for being so honest. But you shared some information, so that is helpful also. Um, what are other sleep disorders you have seen in your patients?
Anxiety, depression, because many times a depressed person tend to overeat.
Overeat.
That
Okay.
leads to obesity.
I see. So it's a
Yes, it's a cycle.
cycle.
Yes.
One after another,
Yes.
things.
The depression,
one thing leads to another.
depression
to
and
another.
sleep apnea is very much associated.
So we should try to live a life so it doesn't cause a lot of stress in our life, right? What are some suggestions, some recommendations you make to your clients when you notice someone is living a very stressful life?
Relaxation, meditation, and exercise.
That's the best thing I have heard. Meditation has become so popular worldwide these days, especially after we had lockdown, COVID. After that, we personally are meeting so many more people who are open to ideas of trying meditation. So, meditation, relaxation, and what's the third thing you said?
Meditation, exercise.
Exercise. So, meditation, relaxation, and good exercises. Is there anything else you would like to share before we conclude our discussion tips for preventing diabetes?
A careful diet, regular monitoring of your health and health related parameter.
I like how you said regular monitoring. I
Yes.
don't know how many people do that.
I think now there is a fairly good health awareness. So anybody who is around 30, 35 or anybody who is getting obese should be vigilant about their health related parameter like HbA1c, their lipid profile. They should take care of their body muscle mass.
So thank you, Joshi ji. We got a
Namaste.
lot of valuable information from Dr. KB Joshi. He's visiting our temple here in Los Angeles, International Society for Krishna Consciousness, and we are just sitting outside the temple. It's very beautiful weather here, so we were very happy to see that Dr. Joshi, he made some time to share some of his valuable life experience with us. I hope all of you will find this information very useful, and if you are ever in Mumbai, you can visit his clinic. You can see him in person, and if you need some help, he will be very happy to help you. So thank you very much. We wish you a very
Healthy life.
healthy life, a happy life, and like he said, try get on to good diet, good exercise, and good sleep routine.
With meditation.
Try live a stress-free life. Try meditation, yoga, spirituality. Come visit our temple. If you are in Los Angeles, I would highly recommend you. We have yoga studios here. People come to practice yoga. We have vegetarian, vegan restaurant. We have beautiful temple. You can come and join us in the various festivals we have. Just recently, the biggest event we are doing is on Sunday, December the 15th. We are going to recite the full Bhagavad Gita in Sanskrit. You can come and join us. There will be people taking Bhagavad Gita, gifting it to others. So please come and join us. We will put the details in the description box so you can find the information and visit us. Thank you very much. Hare Krishna.
Hare Krishna.
Hare Krishna.